The next slide is just to give you a little bit of a flavour of who we are. So you can see some of the bespoke artistry that Sharon mentioned earlier in some of these pictures, and to give you an idea of the layout. And there's a picture of our courtyard, the kitchen, which is fully functioning, and the day area, and this corridor is where the bedrooms are. So Uned Gobaith is a 6-bedded unit for mums and infants to support women experiencing perinatal mental health difficulties. The unit will provide a service for women from 32 weeks pregnant up until baby turns 1 year old. The team is made up of a variety of skilled professionals. So based on the ward, we have mental health nurses, nursery nurses, healthcare support workers, and this is augmented then by the wider MDT, which is made up of our consultant psychiatrist, psychologist, occupational therapist, and we have a specialist midwife and health visitor and social worker, who all work together to provide the best possible care for our women and individuals who access our service. What we do, can I have the next slide, please? Thank you. So our role and purpose, we aim to provide a safe and supportive environment for women during some of their most vulnerable times in their life and what they're experiencing. We provide a setting that keeps mothers and infants together to promote the parent-infant relationship and recovery. We diagnose and treat perinatal mental health symptoms while helping mothers understand what they're going through. And our ethos is patient-centred and focusing on empowering mothers during their time with us. Can I have the next slide, please? Thank you. So how does the unit do what we do? So again, like I said, we keep the families and the women and the infant at the heart of everything. We educate mums and the wider family and significant others in terms of to help them understand what they're experiencing and how to support them throughout their journey to recovery. We treat their illness. We signpost and refer to community services. We support. We protect the mother and infant bonding and attachment, and we empower these women through every step of their journey, most importantly, listening to the women and keeping them at the forefront of everything. And this next slide shows us the referral pathway. So predominantly our referrals are from specialist community perinatal mental health teams, crisis and home treatment teams are often we receive referrals from them also. And then we ask always referrers to make contact with the MBU to have an initial telephone discussion so we can provide advice and support in terms of that referral process. And then our completed forms are emailed and our email addresses up there. And then referrals made within core hours will be discussed with the senior clinical team. Referrals out of hours will be discussed with the on-call psychiatrist, and we always aim to give an answer within 24 hours. And predominantly, I would like to say a lot of the time, we've given our answer within much more shorter time frames than that. And then if the referral is accepted, then we arrange admission into a Uned Gobaith. In the event of no available beds, then we support referrers in terms of the process of how to access an out-of-area bed, including seeking funding from WISC. And then that individual goes on our waiting list to be reviewed daily, and we will always offer admission as soon as we possibly could. If we always ideally try and avoid admission into adult acute areas because of the separation from the baby, which we all know is not helpful. So that we try and support them with community teams and crisis teams to try and keep mums safe. And then, as I said, we can support and help with access and out of area bed, and then the patient would be repatriated back as soon as possible. And then at the end, the mother and infant are admitted to Uned Gobaith and begin their recovery journey. And I noticed in the chat comments that, a question about fathers and significant others. So we have an on-site relatives room that partners or significant others can use. It is a shared facility. and obviously it's only 1 bed, so we have to share that resource out. However, we're very keen to support partners and facilitate visiting as and when we can. We're also developing a pathway, so our charge nurses that are allocated as the secondary name nurse to the individual patient, that charge nurse makes weekly contact with dads to provide support, and we're developing more of a pathway really at present to put things in place to ensure that dads and significant others are supported more fully, because we do recognise the distress and that it can cause for obviously women to come into the unit, and the separation of that family. So we always try and promote to keep the family as close together as we possibly can. Thank you for listening. I'm really appreciative of the opportunity to speak today to give an overview of the MBO and what it is and who we are. Thank you.